Hi, everyone. Good afternoon. Thank you for joining us for the Department of Health Policy and Management's ongoing post-election policy series about the future of health and healthcare under the new administration. My name is Keisha Pollack, and I'm an associate professor in the Department of Health Policy and Management, and I also direct the school's Institute for Health and Social Policy. So I'm thrilled that all of you are here with us today. I also want to acknowledge we have two more of these coming up next month. On April 18th is Tom Burke right here in the front, who's going to talk about challenges for science and environmental health policy under the new administration. And then I'll be back up here on May 9th to moderate a discussion about transportation infrastructure investment and its impacts for public health. Before we get started, I just want to thank all of you for making time to be here today. I know that there's a lot of other talks going on at this time, and we're just thrilled to have all of you here to be part of this conversation on community and political organizing. I also want to take a moment and acknowledge Senator Mikulski, who's here in our audience. Thank you for everything you've done for the state. Thank you for being here. Some of you, we passed out index cards as folks came into the room, and if you have one, those are for you to write down your questions. Susan or others will be on the side collecting them as we go through the conversation, so feel free to write those down. I'm going to begin by introducing our expert panelists who are with us today. After that, each is going to have a few minutes to share some thoughts with you and insights, and then we're going to have a moderated discussion. So please be ready with your questions from these great experts who are going to share their stories and thoughts about community and political organizing in terms of advancing public health. So our first speaker here to my right is Serena Perot, who's used advocacy, litigation, and coalition building to change systems that trap people in homelessness and poverty. Her prior jobs include being an adjunct professor and a fellow at Georgetown University Law School and a community activist at the Washington Legal Clinic for the Homeless. From 2009 to 2014, she lived in London and worked as an advisor to clients at Zacchaeus 2000 and the Citizens Advice Bureau. In her time there, she enjoyed comparing UK and US policy approaches to housing, homelessness, and public benefits. She's received recognition for her dedication to social change from Georgetown University Law School, the National Association of Public Interest Law, and the Bar Association of the District of Columbia. And I mentioned her TED Talk. If you want to look her up in October 2013, she gave a TEDx talk called Housing is a Human Right, which you can find on YouTube. In the middle, our second speaker is Patty Flowers Coulson. She is an alum of the school. She actually received her MHS from the school and began her public health career with the Baltimore County Health Department, coordinating HIV and teen pregnancy prevention programs in area high schools. From 1994 until 2000, she was the health director, then director with the Maryland Governor's Council on Adolescent Pregnancy. And after 9 years of adjunct teaching in the wellness department at the Community College of Baltimore County and 2 years running a parenting education program for the Park School of Baltimore, she conducted 10th grade sexuality education presentations at the McDonough School. After 2 years of volunteering with Baltimoreans United in Leadership Development, she was hired as administrative coordinator at BUILD, running day-to-day operations and organizing the organizers. And our third speaker, Dr. David Jernigan, is director of the Center on Alcohol Marketing and Youth at the school and an associate professor in the Department of Health, Behavior, and Society. He has extensive real-world practice experience in media advocacy, community organizing, and campaigning for public health policy and structural changes. He's written and worked extensively on the strategic use of mass media to influence public health policy. So I'll turn it over to Serena to get us started today. Thank you so much.
Thank you. Really don't like to use microphones. So my name is Serena Perot, as she said. I do sometimes, kind of in the privacy and comfortable rooms, I will admit to being a human rights lawyer. I say in comfortable spaces because I'm a lawyer that believes in the human right to housing, the human right to access to health care, and the human right to access to food and nutrition. And although those are universally recognized human rights by the UN, they aren't recognized here in the United States. And so it's sort of presumptuous here to call yourself a domestic human rights lawyer. I do it, though, because I like to remind people. When I tell people about my job, when I first started my job, I went to the the waiting rooms where people would apply for shelter in Washington, D.C., and I was an ambulance chaser. I would sit next to people and I'd say, why are you here today? Want to be my friend? And they would tell me why they were there. And I learned about moms, it was almost always moms, who'd spent the night before with their children on buses, who'd spent the night before in laundromats. A common place was emergency rooms because they wouldn't be kicked out there, falling asleep on the chairs. I met women whose arms were scarred because they lowered their kids into abandoned buildings. And whenever I tell people about my work, I have a family of Republicans and Democrats. Doesn't matter what their political belief, doesn't matter their background at all. People are appalled that children go hungry. They're appalled that children sleep in abandoned buildings. They think it's unjust that my clients don't have access to health care. And that's universal. What's different, though, about that situation is that the mother who sleeps in an abandoned building is people's suggestion that it's unjust or immoral or a shame doesn't always cross over to it should be illegal. And for me, it crosses over, it should be illegal. And also the blame for me crosses over for many people when I tell the stories about my clients. Immediately their thought is it should be illegal of her, the mother. She should be punished, right, for raising her kids in an unsafe environment. And it's true. When my clients came to me and said, isn't there something you can do as a lawyer for me? There was no law that could force the government to provide someone shelter. There's no right to shelter in the District of Columbia anymore. There used to be. It was repealed. And it was repealed because it was an entitlement program, and government said, this costs too much. We can't afford this program, right? And so they said, we will no longer have an entitlement program to shelter. We will stop that. It's way too expensive. They also had an entitlement program called the McKinney-Vento Act where homeless children had a right to get to school. They said, no, that's too expensive too. We'll give that those federal funds back. We won't accept them so that we're not then required by law to provide an education to homeless school children. So in a time where government really steps away from entitlement, the only illegal action about sleeping in a building might be that mother could be endangering her child, and the only punishment or risk is that her children could be removed, which is why homeless families are so invisible. So I had a tough proposition because I really wanted to change the landscape that my clients were facing, but I didn't have a government that was friendly to providing more services to families that were homeless. I knew that I had a community that was against spending more tax dollars on poor people. The courts had been really friendly until the government did things like, after the courts found in our favor on the McKinney-Vento Act, 2 weeks later, the DC government then gave all the money back to the federal government rather than comply with the law, right? So you can only get so far with the courts, right? It's a whack-a-mole game, and I kept losing it. So what I started to think about is the other things that government gives us that we don't question ever, right? So, my dad believes he has a right to a pothole-free drive. He believes that with every fiber of his being, right? And if there is a pothole, a phone call will be made, right? Everyone in my family thinks of it as a thing that you can pick up the phone and a fire department truck will show up if you have a fire, or a police officer will show up if you want to report a crime, right? Absolutely, that's entitled. We're entitled to that as members of our society, right? We all expect that, if we have children and we want to send them to public school, that we'll be able to do that they have a right to a public education. All of those things used to be privately funded. They all used to be. It used to be if you were rich enough, you could have a cop on your corner. If you were rich enough, you paid into an insurance fund and you had a fire department. And if you were wealthy enough, you sent your kids to private school or a tutor, right? Those are concepts. There's no constitutional right to any of those things, right? There's nothing written, etched in parched paper in the National Archives that allows us that. We believe that in our hearts, though. Why do we believe something that just isn't out there, has not been written down, isn't true? Why do we believe it? Because it fits with our values, and we as a collective have come to believe in these things to be part of who we are as Americans. And I honestly believe, because I get that reaction when I describe children growing up in laundromats and hospital waiting rooms and on buses at night, I think that it resonates with people that that's unjust and unfair and wrong and a shame. And I think it could cross over to resonating that we don't need to just place the blame on individuals, but that there could be institutional responsibility, that part of the cause of that could be institutionalized acceptance of racism, institutionalized acceptance of poverty, and that we could look at our institutions that perpetuate those things and we could ask them to change. But we're only, and this is why I switched over from being a lawyer who uses mobilization and uses organizers in my work to one that believes that lawyers are probably the least important tool of the work that I want to do. Because the change that we need to make is the change in people's hearts and minds, where they will adopt a new philosophy. And that change is very relational. It is not hierarchical. If I tell you what to believe, you will not believe it. I promise you, I'll try. Believe in a right to housing now, right? I hope that worked. Right? That will not work. You will have to be persuaded by time, experience, and your relationships with others. And that work is incredibly effective. Think about how inconceivable marriage equality was 30 years ago. In 1972, lawyers brought a case to the courts. They lost because it was inconceivable. Our society wasn't there in the hearts and minds of people who make up courts and make up legislatures. And today, when Trump was elected, my kids asked me, how frightening was it? And was this really dangerous for our gay friends and neighbors? And I said, there are some things you can't put back in the bag, right? People who have come out are out. People who love someone who they now know is gay still love them, right? And we will not be able to go backwards because too many hearts and minds have changed on this one. And I think that's really important, because for the real victories that we get, the real political successes we have, things like the right to vote, things like marriage equality, and the smaller ones, they all actually come from a belief in people's hearts that their values line up with their politicians and their rules. And so I know I've taken too long, and I will enjoy telling war stories. But I think this is why I became convinced. I use mobilizing. I'm not an organizer. I use mobilizing my work. But I work very closely with organizers. I became convinced that work without them was close to useless, because it can be eradicated because it has no political strength. So that's how I came to this.
So they say I organize the organizers, and I tell people it's like herding fruit flies. They sort of come in, they take everything from you, and then they leave, and you can't find them. So, but that's a good thing. So I'm not an organizer myself, and frankly, I came kicking and screaming to build in a way because of the language that they use. So I was trained very well here at Hopkins in the health policy management about needs assessment, the public health approach, evaluation, all of those things. And when they started talking about relational meetings, I just didn't have any kind of framework for that. What's a relational meeting? You mean networking? What is it? So for me, it was about learning the language that the organizers spoke. It was about watching the success of the actions and the politics that they played in a way that brought people together and gave them power. So honestly, one of the things that really struck me as a public health professional, which I still consider myself to be a public health professional even though I'm not working in the public health arena, is that when I was a very studious health education student, and I was learning all about Larry Kincaid's pre-seed, proceed model. I don't know if they still teach that. Do they still teach that? Okay. Remember the quality of life indicator thing that you're supposed to do? That's the first thing. Here's the problem. Where's the funding come from? Funding is by issue. So you get funding to address teen pregnancy. So you've got to go out and find, say, a teen pregnancy problem. And the people there may be more concerned about getting a job and finding a way to pay the rent and feeding their families and finding whatever, getting a grocery store on the corner. But you're there to address public health and teen pregnancy because that's what the funding is for. What I learned finally with organizing is that community organizing really is that first piece of that pre-seed proceed model. Community organizing really is the piece where you go in and actually learn what the quality of life concerns are with people. And it's not just about collecting data. It's not about sitting down and having a conversation. It's not about ethnographic collection of data even. It's really about listening to someone and learning about their passions, their motivations, the obstacles to getting what they want, and forming a relationship with them. That's a really difficult thing to understand, how to form a relationship, because it's not a private relationship. It's not making friends with someone. It's not learning about their very private issues. It's about how are we going to stand together and bring power into an action. So one of the things that we talk about is self-interest. We talk about self-interest. So self-interest is not selfish interest. Self-interest is, everybody's got a self-interest, right? So for example, we were looking at the let's see, I'm gonna get this right, Healthcare Services Cost Review Commission, something like that, Health Services Cost Review Commission. Now, they are the ones who set the hospital rates for reimbursement for the hospitals. They are not a job-making entity, but President Daniels and Dr. Peterson got together and brought together even University of Maryland. They even brought University of Maryland into the Hopkins fold, which is a miracle. So they brought everybody together and they said, what is it that we're going to do? We've got to do something. We've got to improve health and bring jobs to the community because they saw that jobs were huge. And they dreamed up this thing to say, let's do 0.25% of increase in the hospital reimbursement rate so that we can hire 1,500 health community outreach workers, right? So the people would go out into the community. And that works really well. People from the community doing outreach in the community. And the president of an insurance company that shall be unnamed, but is the largest regional insurer, decided that he did not agree with that. That was not a good idea. Never mind that there's, $1 billion surplus in this not-for-profit company. But what we decided to do was to find people who cared about it, people who would stand up and really care about the issue of jobs and care that we had a chance to make systemic change in Baltimore City, in some of the most distressed zip codes here and around the state. And we took, I'm going to say, about 80 people, and we took a sheet that had quarters on it, 1 quarter for 1 Baltimore, so it was really just a quarter you're talking about when you say 0.25%. And we kind of marched around the building, and we disrupted. So the idea behind this is finding people whose self-interest was needing a job, people who have criminal records who find it difficult to find work, people who get up every morning and have issues with violence and with an elderly mother with diabetes and so forth, who really wanted to influence this particular insurance company. Now, that didn't have so much of an effect. That didn't work so well. So that was a really good mobilization effort. And it made people feel like they were getting somewhere because they were doing something together. But what really made a difference was we showed up at a health services cost review meeting. There are all these people in there that are fondly called policy wonks, and they were standing up and they were talking about this, that, and the other formula. And then people in blue t-shirts were sitting around with their Build blue t-shirts and talking about how they really needed to get a job and how this was going to make a difference. We didn't just show up at 1 meeting, we showed up at 3 meetings. And now, while the Health Services Cost Review Commission did not at that moment give us what we wanted, ultimately, they and the hospital consortium of 7 people, 7 hospitals, worked with them to come up with a smaller increase and a smaller amount of jobs. And Build is now, with our Turnaround Tuesday program, a pipeline for 208 community outreach workers here in Baltimore. So we've graduated the first class and we're teaching the second class. That's how you win something. And it's not about empowering people so much as it about how do you recognize your own agency. You're someone who has been taught again and again and again that you cannot get anything done. You can't, you're too small. You can't do anything about it. But you whittle it down to an issue on which you can take action and show people they have the power to act, and that's how you get it done. So for me, that's what organizing is really about. And that you know, with public health, I really do see this piece as being critical. If you're going to make policy or you're going to design a program, the first thing you want to do is really make relationships with the people to find out, where have they been? What are their stories? The stories are really important. Everybody's got a story. So whenever we go to trainings to teach about individual meetings and making relationships, I'm always the one, because people are like, oh, Patty, she's so good at being vulnerable. I just don't really care what people think anymore. So I'm happy to tell some story about something or other, some crazy thing my parents said one time, or, whatever, that helps people to understand that there's a reason that my passion comes from somewhere. And that's what you really need to get at. And I think it's hard to shift, to make that shift in your head as a Hopkins student, Hopkins faculty, from the evidence basis, defining the problem, finding solutions, evaluating, et cetera. It's really hard to make that shift into this is about personal relationships in the public sphere. But public health could really bring that evaluation piece. One of the things that organizers don't do well, even though we have SMART goals, measurable, realizable goals, is do the evaluation piece. And that frustrates me, because I think we could get a whole lot more money behind what we're doing if we had that. So that's my little piece.
Good afternoon. I am honored to be on a panel with these two people. I wanted to start just by saying a little bit about how I got to be here and sort of the role of organizing in my life. My father was a professor, but he was a professor at the School of Theology where Martin Luther King did his training. And so I grew up sort of steeped in something that was called at the time the social gospel. It was basically a response to the Holocaust, where American Protestants, at least one group of them, said, we let this happen, we can never let this happen again. We will stand witness against every form of injustice. And that's how I grew up. It was just sort of in the water, in the food, at dinner. It was a sort of naive set of expectations to grow up with. It was sort of shocking when I got to college and realized that everybody didn't grow up that way. I started marching when I was in high school. In college, I organized around the Vietnam War. The war ended. I organized around a U.S. foreign policy. I organized a demonstration at Harvard my senior year that ended up shutting down the administration for 24 hours over apartheid. Graduate school, the high point of my graduate activism was probably getting arrested with Maya Angelou. And she and I led the songs together that day. It can be fun. I sort of started in public health in the Reagan years because health was, in that era, the only place that I could see where people could still agree that there was a role for government. Nobody wants to die. And so it was just very pragmatic. I kind of fell into public health, but I brought all that organizing training with me. I'd been in public health for about a year, and I got the opportunity with some friends of mine to start an institute that was and is funded in perpetuity to work on alcohol and drug issues. And we mostly worked on alcohol. Alcohol kills, it's our favorite drug. It kills 3.3 million people a year worldwide, 88,000 in the US. A huge factor in health disparities in poor communities. I didn't have any particular alcohol story, but I have a justice and I have an organizing story, and everything that I ever cared about turned out to have an alcohol angle. I should say I had marched for gay rights. I marched across Florida for gay rights at a time when two of The churches in the denomination I was in, a gay denomination, had been torched, and we had to have police protection, to get into Tallahassee. But I was trained. You put your life, you put your body, you put your mind on the line. That's the right thing to do. The work on alcohol has really shaped what I do in public health, in addition to my own background, just because, we have tried to teach people about, you talk about teaching people about housing being a right. Good luck teaching them anything about drinking. Nobody wants to hear about it, and the individual level approaches just don't work, and at the same time, there is a $1 trillion business behind alcohol. Huge multinational corporations that are actively determining the shape of alcohol in people's lives on an everyday basis. They are the most active players in communities. And so I've spent my career in public health going into communities. Communities really sort of at every level. Communities all over the world, and trying to give them the tools to be able to push back. And some of that is information, some of that is research. That's the research side of me, pursuing the questions, which I get attacked by the industry for, but I choose my research questions based on what we need to know to move policy forward, to move change forward. But that's only one piece of the puzzle. And so the courses I teach at the school are, yes, I teach about alcohol, but I also teach campaigning and organizing, and I teach media advocacy, because we don't get anything done against a huge, huge industry without having some form of power. And the power that we have isn't money. Yes, information, knowledge is power. That was the motto of my high school. But knowledge, I love de Tocqueville, who said, 200 years ago, that in democracies, the knowledge of how to combine is the mother of all other forms of knowledge. And so I want us to be parents of all sorts of great knowledge. And so I teach the knowledge of how to combine. There are technologies of how to combine. They are very retail. They are very person to person. I teach them with a friend of mine, old friend of mine named Ayelet Hines, who has a blog, and she blogged about a month and a half ago about how we got ourselves into this situation. And one of the things she points out in her blog is, starting in the 80s, we turned the organizing over to the professionals. In the 90s and the aughts, we turned increasingly to social media. And social media is cool. It can do lots of great things, but I love one of the lines in her blog, and I'm going to read it as it's punctuated. Get off of Facebook. Because Facebook is the illusion of relationships. It's not the relational thing. It's, what Serena talked about in terms of building relationships with people where they trust you enough that they'll listen to you and respect you and respect what comes out of your mouth. Facebook is great for sharing stuff. My granddaughter was just born this morning.
Congratulations.
And so, we're all over social media this morning, but that's not changing anybody's minds about granddaughters. So I'm a huge fan of organizing. I don't call myself an organizer at this point. I want our students to know how organizers think, because I think that the technologies of organizing are really critical tools in the social change toolbox. And I think public health is fundamentally about social change. There's a research role in this that Patty referred to as well. Every organizer I've ever worked with believed that their version of organizing was what everybody should do. and it's conviction, and they believe it, and it's great, and it keeps them going and gets them up in the morning. But we have very little research that actually compares one modality of organizing to another, that actually provides people with evidence-based knowledge of when you'd want to use this tool, when you'd want to use that tool. This is an incredibly under-researched field. It's also an incredibly under-resourced field. It's very difficult to get the federal government or foundations to fund organizing, because organizing to change big things, you're looking at a 10-year timeline. And I just don't know a lot of foundations that are willing to put in that level of commitment where you see very little in the beginning. You know, because one-on-ones aren't something a foundation can write about in its newsletter. And yet they're so critical to big change. So my big thing in the current area, you know, federal systems provide us the opportunity to work at every level. And when things get paralyzed at one level, we can still go to the other levels. That's a great strength, and that's where a lot of my work is these days, because frankly, getting anything done on alcohol at the federal level has been a challenge. But I'm also just an incredibly hopeful guy. And I feel like hope is a fundamental characteristic of good organizers. It's very difficult to follow someone who's depressed. And so I am very hopeful. I think we're seeing huge cracks in the system. We're seeing the things that we haven't done that we needed to do more of, and the potential of this moment is enormous.
Thank you to all three of you for your wonderful comments and for telling us a little bit of your story. I have questions, but I know there are questions in the audience, so maybe I don't know if you have any on the cards, or if people want to just raise your hand and have any questions for our panelists. Yes, sir.
Thank you. First, thank you for coming and sharing your insights. I've been community organizing in the city for 2 years and outside the city for a year before that. I do not come from the conviction that I have the best method over it's terrifying to me, especially the neighborhoods I work in. I would show up looking like this, pretending like I know what's best, and get thrown out really quickly. One concern I have throughout this dialogue, though, is when we talk about the role of research and the role of those organizations or individuals representing organizations that are in a relatively large position of power entering communities to organize, there seems to be little talk about stepping back from that position of power to put the people in the community in charge.
Mm-hmm.
So the line that I wrote down is it's not about empowerment, but about recognizing their own power. And I think, again, I don't think my modality is correct, but this is central to like the organizing that I've seen has been successful, especially when the organization doing the organizing is so powerful. They operate in this model. I am concerned, though, when we talk about public health, the ivory tower of academia entering a community and trying to help, what role, which I do agree that there needs to be better assessments and there needs to be better research done, but doing it without seeming like you, as the powerful, typically white organization in control in this community, seems scary to me. And I'm afraid how to like invite, like I'm a community organizer. My girlfriend's in public health. She works for, and I have no idea how to invite her into my work to get help from her field. It's scary to me. So as people who are both in academia and community organizing, I'm curious what your thoughts on this are.
Yeah, great.
That's such a great question.
Who wants to
Yeah.
take that?
I just want to say you've nailed the central conflict of organizing and mobilizing, which is that organizing imagines a world that is not hierarchical, and where the information about what needs to happen next comes from a dialogue. It's very democratic, it's very egalitarian, which is fantastic, and so again, really resonates with a value that I think we've all been raised with, right? But what happens quite often in organizing is that for that moment to happen where people realize that they have individual power, organizers pick a target and they pick a strategy and they go after a goal. And when that goal is achieved, the people who were part of that group realize their own personal power. Where what happens is there's a symbiotic relationship between organizing and mobilizing, where people on the ground in my community come to me and they say, I am frustrated because my school is crappy, right? Isn't there a law that makes them fix the school, right? And so they come to me and I can come to them and I can give some strategic goals about what laws they can use. Where could the funding come from to fix schools, right? In a way, I've hijacked the hierarchy. I've imposed a hierarchy then. I have a plan, right? I have an agenda. I am thrilled to know that they think their schools are crappy. I do too, and I think that hurts poor kids, and I want poor kids to have a better ladder of education into jobs. So here we have this symbiotic relationship where I need those organizers, and those organizers also need me because I can help them unravel where the points of power are and where the law is currently and where the law has the potential to change, right? And so, but my mode of work is very strategic. It's very goal-oriented. I have an agenda. That is the opposite of what I just described, right? It's hierarchical, it's top-down. So these two things, they need each other. I am absolutely going to be unsuccessful unless there is a base of like-minded people who have connected to one another through organizing. And organizers are also much more likely to be successful when they take that organized base and they have strategic goals, right? And so they do need to connect with experts. They also need to control those experts and tell them to get the hell out of the room sometimes, right? So they need to retain their power. But it's a complicated relationship, and that's often where a lot of the tensions come, is that people forget that we have different roles to play, but in the same room. And we need to be in the same room, I think, because that's actually where you get progress. So, yeah.
I just actually, tell me your name.
Yeah.
James. And what neighborhoods have you been organizing in?
McAllister Park, Upton, I do a lot of stuff at the New Baltimore Rec Center over west. Since I'm down here in Milton,
Mhm.
my organization's based in the core, so
Okay.
unfortunately we're right.
Yeah, and what got you into organizing?
Audrey Lord's speech on dismantling, can't use master's tools, dismantling master's house.
Yeah, okay. And who are you working with for organizing?
I work with the Connect, Stand Up Baltimore, Be More for Youth, and Strong City Baltimore.
Right, okay. So I just did a little individual meeting there, if you didn't notice that. It was the very beginning. But anyway, what I wanted to say is it's a really loaded question to ask what you asked here at Hopkins, of all institutions in Baltimore. I'm sure you all know some of the history, that Hopkins has quite a reputation among many of the neighborhoods that surround Hopkins and even don't surround Hopkins, about kind of grabbing people off the streets and experimenting on them. And the Immortal Cells, Henrietta Lacks, right? That didn't help the reputation. I think that what public health has to bring is the expertise, like Serena said. And I would hate to see public health like walking into an organizing setting to do anything other than listen. That's what I think is the very first thing, right, is to listen. And I think that we have to develop that, especially, I love social media. I love Facebook. I went to sleep last night on Facebook. How, sick is that, right? But it cannot, and Snapchat and Instagram and all those other things cannot substitute for actually sitting down face to face with someone and talking to them. And I know now I sound like my mother, but you really have to do that. And I think young people are very good at it. My son, who's a social media maven, is really good at forming relationships. My younger son, my older son is not. And he can rely on losing himself in social media. But I know you know how to do it for the most part. And it's really just about being curious. And I think one of the reasons that Hopkins continues to struggle with this reputation is because even though we know how to do community outreach, and I'll tell you who, Mark Farfel inspired me beyond belief, right? And Mark Farfel got into a lot of trouble with the lead paint issue. And I love the Farfel family, right? And I think Mark Farfel's heart was in the right place, but he didn't form relationships with people when he really needed to do that. And that's, I think, really important, that you have to form those relationships. You can't just walk in with, I know what you need. Like you said, I know we need to have better schools. I know we need to solve this lead paint problem. You get to a level of desperation, and then you forget to form relationships. So I know I stepped in it there, but I just needed to really.
And David?
Yeah, it's a really, really important question, and we could talk a long time about issues of entry and how you get invited into a community and what it takes to build a level of trust. I hire and supervise organizers, but I'm not the frontline organizer. I feel like I get wheeled in when they need the expert, and I provide the technical expertise. That's what I've spent 30 years kind of developing. But I work hand in hand with the organizers. And I'll tell you one story. You know, this institute we started in California, it had money, we could do things long term. We were in a fairly wealthy county that had two pockets of, one of primarily African American people, one of primarily Latino people. And, you know, we wanted an organizing department. So we looked around to hire an organizer, and there was a woman in the county who had been trained in organizing at the UC Berkeley School of Public Health, Meredith Minkler, folks like that. Yeah, and she knew she really wanted to organize on health issues in our county. So what she had done is she had gone into the mostly black community and joined the choir. And she had sung in the choir for 2 years without doing any organizing or anything. She had built relationships. She had gotten to know how that community worked in a certain way. There's so much more to know, but in a certain way, she'd built enough credibility. You know, she didn't, whatever things she didn't have, there was no question she was the person we were going to hire. And she ran our organizing department. We organized based on the Alinsky model. There are lots of different models for organizing. I've been eclectic with them throughout my career. There are times when you can get something important done quickly, and I have been guilty of mobilizing. But the big changes, you know, I mean, this is fundamentally about power and understanding where power comes from. I love the line that you used about empowerment, because I've had big debates over the years about the whole use of the word empowerment. Like, I'm going to give you your power. No, I'm just going to, at the most, maybe remind you that you have it, because you always had it. So thanks for the question.
Yeah. And I see a couple of hands in the back. I wanted to say I love your comment about listening, and I also really want to add to that. Really, for me, it's been listening from a place of humility and respect. And I think that that's so critical when we're going into the community, working with organizers or people mobilizing. So the one with the scarf, and then the woman in the back.
On kind of the flip side of that question, Patty, I think you mentioned the idea of public health often focuses, whether it's funding or whether it's topic-driven, on if it's a teen pregnancy prevention intervention and you get in there and it's about jobs, what do you do? So I think ultimately, as you've discussed, community organizing is a way to do better public health, and that without it, it ultimately limits us. However, in the school, I'm finishing the end of my 2 years there, and I don't think I've ever heard one person ever use those two words together at once. And it's both, I think, a fear of being political, a sense of not being, sorry, I haven't taken.
How about so you clearly didn't take David's class yet.
But that ultimately, it profoundly limits what we're able to do, and it, I think, is sometimes talked around, yet it feels like a big fear of both public health as a practice and as the school. And I'm curious about your thoughts about how we better market it as a tool to do better research or do better work or integrate what we're doing within our school versus some kind of external or political, thing that's very separate from us and very different from the work that we do.
Yeah. Thanks for that. I think I'm the professor here, so. I mean, let me first just mention this new Center for Public Health Advocacy that the school has started, and the fact that the school has made a collective decision that we can have a Center for Public Health Advocacy is an important step, kind of recognizing that that needs to be part of our work, that it needs to be part of all of our work, research, training, practice. The cautions around it, yeah, I mean, I get suspected here because I'm too political. But my argument is, you know, the politics of public health research begin when you pick your question. You were interested in that for some reason, and that is a subjective decision. That is not completely objectively driven by some exterior force. And you were shaped and you were formed. The important thing we do with our research is that we do it in ways that are replicable, in ways that conform to best practice of science, that can, so knowledge can build on itself. But this idea that we have to be separate from the world in order to create knowledge is odd. I love the Einstein quote. I'm just going to throw out another quote. The Einstein quote, those of us who have the privilege of knowledge have a duty to act. And in that action lie the seeds of new knowledge.
I'd just like to add that I'd love to see someone do a dissertation on community organizing and public health. So I'm getting too old to go back for my doctorate. But I think that the problem is funding at its root because people, again, foundations, government, et cetera, want to fund issues. They don't want to fund communities. And I think that if there's a way to, for example, teach for if your issue is alcohol or your issue is whatever, find a place where there are community organizers in those communities you think that you want to do your work in and connect with them before you ever even define the problem. And again, when you are doing research, it's more than just a problem. You have to find something that's quote unquote actionable. You have to find a way to define an issue that can be resolved. You can say we have lousy schools, but that's a problem, that's not an issue. You have to drill down to the issue level.
Great, thank you. Yes, ma'am.
I laughed a bit when you said that each organizer thinks that their own method is the best, because I used to be a trainer for Midwest Academy. But I was just curious just to ask this quick question, how you learned, how you were trained as an organizer. David, it sounds like you just kind of grew up and picked it up, but I wondered if the other two of you had gone through some kind of formal training with the union or Midwest Academy or some other organizing training institute.
Midwest Academy, yeah, they were sent to, I had a fellowship after law school.
microphone. Oh, thanks.
It's sort of boring. I had a fellowship after law school that actually everyone who won this fellowship said that they had 3 prongs to the work that they were going to do, and one of the prongs were you were going to act like a lawyer, but one of the prongs was that you were going to think strategically about how to change fundamentally the problem that you were addressing as a lawyer, and so they had us do a training, an abbreviated Midwestern Academy training.
I've been to the abbreviated version, the 3-day training, 2 3-day trainings of the Industrial Areas Foundation, the IAF training. Although I have to say that I did spend some time on Highlander and on Midwest Academy websites and found Midwest Academy's language to be somewhat similar and overlapping. But I'm not trained enough to be an organizer to understand the subtleties of the differences.
So I teach modified Midwest Academy. My own formal training has been on the job. Way back in college, that foreign policy organizing that I did was led by 2 women who went on to found 9 to 5. You know, I should say dissertations. 5 of my dearest friends in college did the first collective thesis in Harvard's history. They each worked in a different form of organizing the summer before senior year, and then they wrote their thesis on comparing them, you know, neighborhood, issue, union, faith-based. Really, really interesting project. At our institute, we sent our folks to be trained at IAF, and we also sent them to Highlander. And we tried to adopt some of the Highlander techniques and some of the things we did. I was also trained in Freirean popular dialogue, which is another modality.
Great, thank you. We'll go to the back. Deja? Yeah.
Thank you for your
It's a great question. It's a really great question. I'm going to speak to the piece I heard from it. I think there are many pieces in it. But I want to talk specifically about listening because it sometimes looks odd in some of my classes, but I teach listening. Particularly when I teach organizing, I teach listening because my experience is that most of us in a conversation are waiting for our turn to speak and figuring out how we can bring our story to relate to the story being told. And that's not entirely listening to the story being told. So I put a gag order on my students and I make them just listen without responding at first. I teach them an attitude around listening, to treat every person that they are listening to as if they are absolutely brilliant, incredibly creative, have done the very best that they possibly could in their life up to this point. Things like that. To put on, if you're not saying anything, to put on a face, to figure out how to make noises that show you are really genuinely interested in every word that comes out of that other person's mouth, no matter what they're saying. And it is maybe a way of trying to move aside the judgmentalism, the prejudicial things that we bring into relationships. Because I think good listening is a really important part of any relationship. So that's the piece I pulled out. As we go forward in this listening, and we've got people at the school who do incredible research on this, to bring an awareness of the power dynamics that you talked about and how to give space to, as a friend of mine used to say, people who are on the target end of oppression when you're on the non-target end of oppression, and what there is that you need to think about there, how that's a different form of listening, and that there are potholes and jewels in figuring out how to make that relationship work. It feels very touchy-feely to do this in a school of public health, but it's been so important to the organizing, I do it.
I'm going to suggest that you organize. If you really want to make change, find other people who are as interested in it as you are and sit down and get to know them. That's really the simple answer.
Great. Yes, ma'am.
How can the title of this forum, this panel, talk about the new administration? Obviously, this is a different ballgame, but what strategies, how will our approaches change? How do we have a voice? How can organizers perhaps communicate with this administration, because it's so different from the previous one?
Just real quickly, one of the things that we've been talking about is how to do just what you're saying, and bringing leaders together from all of the Metro IAF affiliate organizations and working on strategies for doing just that. One of the pieces of advice that people started out with was you find 5 people who voted for the current president and talk to them and do an individual meeting. The trouble with that is that there are certain people who feel so threatened by those people who voted for him that they can't do it. So I think somebody like me, I can do it because all I have to do is call my parents. Yes, I still love them. But I think that working with that is going to be very difficult, but I do think there's a piece of listening. And I think white people have to take some of that burden, in fact, all of it, to start understanding people who voted for the administration and trying to understand them. In terms of getting to the administration, the classic IAF answer is do a power analysis. For example, like what's going on with immigration? We have an ICE director right here in Baltimore, and we've seen some roundups and some things that don't look very nice. So how do we get to him? Who does he relate to? What's his interest, et cetera? So that's the IAF approach to it. I don't know. There are probably other model approaches that would work.
Well, my little motto is mourn all you need to, but for God's sakes, organize. Because this is, when I look at the election, when I look at what happened, I don't know. I'm so inspired by a guy who teaches up at the Kennedy School at Harvard, Marshall Gans, who Marshall was a consultant to the 2004 Dean race, and then Dean brought him in to the 2008 Obama and to the Democratic National Committee. And one of the fundamental things that Marshall was trained by Cesar Chavez. He was a farm workers organizer. He ran an organizing training institute in Monterey for years before he went to the academy and did a PhD in sociology on social movements. He's a really interesting and thoughtful guy, and one of the things he did in the Dean campaign was he took the house party, which has traditionally been largely a fundraising tool, and he turned it into a listening tool in that campaign. So that it was much more of a listening and organizing tool, engaging people much more than just or than even their dollars. And he trained a lot of the organizers in the 2008 Obama run, the 2012 Obama run. These were retail organizing campaigns, and I feel like in 2016, we let it get too professionalized. It's easy to be a Monday morning quarterback, and so many people worked so hard and poured their hearts and guts into that campaign. But one of the lessons to me is we got to go back to retail. We got to go back to figuring out how to reach people. And that's what's inspiring me about what people are doing in the wake of it.
Yeah, I would just like to add that there's so much that can be done locally. I think of it as a sort of protection mechanism, but there is so much that can be done locally to protect our communities so that our communities reflect our values. So, sanctuary cities, making sure that our local politicians have a spine about sanctuary cities and what does that mean to you and what does that mean in your community, and are we going to show up for our immigrant neighbors if they're threatened, right? I can expect, lucky me, a tax break, right? I'm going to demand of my local city council that tax break be resumed by the District of Columbia and spent as it would have been spent in federal, if it had come to us in federal dollars. So we're going to see massive cuts, I know it, in programs that I care deeply about, and massive harms, mainly to low-income communities and communities of color. And I want that tax break to be captured, and I want it to be spent exactly the way we would have wanted to spend it as a community. And I think there are lots of things that we can do locally that where we can ask the people who represent us to also represent our values, and identifying those specific areas where they can stand tall with us and fight back. I think it's actually pretty easy once you start to look at the legislation coming down the pike.
Great. I'm sort of mindful of the time. I think we might just be at our end as I look to the back. I want to just, first of all, ask all of you to join me in a round of applause for our three phenomenal speakers. On behalf of the Department of Health.
Keisha, I just want to thank you and
Oh,
HPM.
yeah.
I think,
Thanks.
Yeah, no.
Thank you.
I feel like what we've had here today is the beginning
Yep.
of a conversation, and I really appreciate your opening up the conversation. It's
Yeah.
an important one for us
Thank
to be
you, and
having.
I'm just going to say on behalf of the Department of Health Policy and Management and the Institute for Health and Social Policy, we're grateful for all of you for being here and for beginning this conversation, a really important one. And I think a lot of what we heard today is not only critical for this time we are in our world, but also in the future when there's another administration 10 years, 20 years from now, these strategies around mobilizing, well, I meant to say 4 years. Absolutely. In 2 years, 4 years, yeah, absolutely. Absolutely. So these strategies are important now. They're important decades from now. They're important for change, for policy. And I appreciate the comments about mobilizing and political organization and the importance of them for public health. So thank you all for your comments, and thank you for being here. Appreciate it.